Let's talk type 2 diabetes and fatty liver disease. Type 2 diabetes is a risk factor for fatty liver disease, and fatty liver disease is a risk factor for type 2 diabetes. Fatty liver disease is when over 5% of the liver is occupied by fat cells. Here in the United States, over half of people with type 2 diabetes have fatty liver disease, so it's important to pay attention and know your risk. Why? Well, because the fat in the liver can cause inflammation, and this inflammation can lead to fibrosis. This fibrosis can progress to cirrhosis, which increases the risk of liver cancer. Both of these last two being a major reason for the need for liver transplantation. So how can people be screened for fatty liver disease? Well, one straightforward way is by looking at liver function enzymes, which come from a blood test like AST or ALT. However, you need to know that sometimes these measures can be normal in people who have fatty liver disease. A second screen are more advanced blood tests, such as the FIB-4 index or the NAFLD fibrosis score. And this can be done in high-risk individuals and takes into account not only the liver function enzymes, but things like platelet, BMI, and age. And a third screening test that may need to be considered for high-risk individuals: imaging studies, such as ultrasound or ultrasound with elastography, which checks for a degree of fibrosis in the liver. If you have questions about type 2 diabetes and fatty liver disease, please discuss this with your trusted health team and stay tuned for part 2 where I discuss management strategies.